Okay. Okay, doctor. What is your station?
A metabolic syndrome.
Metabolic syndrome. Okay, share the screen.
Sorry, doctor, I cannot see the task.
You did not see it?
No, it's
Oh, sorry. Metabolic syndrome. Okay. Sorry.
okay. I'm ready, doctor.
You ready?
Yeah.
1, 2, 3, go.
Good afternoon. I'm Dr. Fekir, a psychiatrist from the Mental Health Clinic. How may I address you?
You can call me Tom.
Tom?
Tom.
Tom. Hi, Mr. I understand that you have done your regular blood tests recently, and we're here today to discuss the results. Is it okay?
Yes, what is wrong, doctor? This is the first time for me to be asked to discuss the results of my blood test with the doctor. I used to do this blood test once every 6 months, but this is the first time for me to be asked to talk with the doctor.
Yes, I understand your worries, but let me to ask you what's your understanding about routine blood tests?
Well, since I've started my medication, the olanzapine, I've been asked to do this blood test once every 6 months, and I'm doing it regularly for the past 5 years.
Yes, you are right. We have to do this, and we found some results out of normal range. There is nothing preventing future. Nothing to be worried about.
Yes.
But we have to look at to prevent any future problems.
Okay. So what is in the blood test?
Yes, we found that the blood sugar and fats are out of normal range. So it's a bit high, and the bad fats also, it's a bit high.
I see. So anything else in this blood test, which can be worrying, doctor?
Apart from the blood tests, we found that your blood pressure is a bit high also.
I see. So what could be the reason behind this, doctor?
Exactly. I would like to tell you the reason, but firstly, I understand that you were on clozapine for the past 5 years, yeah?
Yes.
Yeah. How do you find this medication?
Very helpful.
Okay, that's great. If there is any side effects happened?
No. As far as I know, it is a very helpful drug. It's the only medication which helped me.
Okay, that's great. Also, your waist circumference may be higher than normal, and it seems that you put weight recently. So all of this means that you have a condition called metabolic syndrome. Do you come across this term before?
No, what is the metabolic syndrome?
Yeah, it is a collection of symptoms. What happens in a group together, a known side effect from clozapine. It means the body cannot process the fats and the carbohydrate well.
I see. And what could be the cause of this for this metabolic syndrome?
Yeah, there is a lot of causes, and I would like to explore it with you more to know how we can proceed. Is it okay?
Okay, no problem.
Yeah. In a typical day of you, could you prescribe your eating habits?
Well, I'm not very keen to eat very healthy. I'm a computer technician, and I don't. So most of the time sitting behind the computer, just eating what's available on the fast food menu. And this is my eating habit mainly. Yeah.
Okay. So do you see your eating habits played a role in gaining weight?
Well, I don't know, doctor. I've never thought of this.
Okay. And what about your activity level? You mentioned that you didn't.
No,
you didn't.
I don't exercise at all. Maybe last time I went to the gym was about 6 months ago.
Yeah. And are you able to increase your activity level, or there's any problem?
No, I don't have any problem with that. I'm just not keen to do this.
Yeah. Do you smoke, Mr.
Yeah, I smoke 1 pack of cigarette every day.
Yeah. I see. And what about alcohol?
Well, I drink beer while I'm eating, maybe 3 cans of beer or 4.
Yeah. Do you find that you have any problem with drinking alcohol?
Well, I can stop it, no problem. But I used to drink beer while I'm eating.
Okay. Okay. That's good to know that you are motivated to stop alcohol, and this will be very beneficial. Can you tell me if you have any physical health problem?
Not as far as I know. I've been, I do my regular checkups and follow up with the GP. Everything is okay.
That's good to know. Do you receive any medication apart from therapy?
No.
And I would like to ask about your family history. If there is anyone in your family has obesity?
Yes, my mother used to be a bit obese.
Okay. And what about heart problems?
No heart problems.
Diabetes or hypertension?
No.
Okay. Okay. Mr. Tom, I can see that you are happy with clozapine.
Yeah.
But you developed a side effect called metabolic syndrome, as I mentioned. And how do you feel regarding
1 minute remaining.
taking steps to manage this condition?
No problem. I wish that but I hope that it doesn't include any change in the clozapine because it really helped me.
Okay, okay. So we will work as a multidisciplinary team. We will liaise with the GP. He might follow up your case, your condition, and he will give you some pills if there is any tests not improved. Are we okay with this?
Yes, no problem.
Yeah. Also, we may refer you to a dietitian and try to increase your activity level to be exercise maybe 30 minutes every day for 4 days a week. Are you able to do this?
I hope. Maybe I'm overweight now. I don't know if I will be able to exercise.
To know, and also smoking cessation clinic, it's highly recommended to be referred to this clinic.
Okay.
Yeah.
Time. How do you feel about what you did?
Time management.
How do you feel? How do you feel about what you did, Doctor? What?
Time management. Time
management. Yes. I felt that you are very reluctant in your approach. It will come with practice in order to make sure that you omit the unnecessary sentences.
Yes.
Nothing to be worried about this thing. This is a fake reassurance. Actually, patients who have metabolic syndrome should worry about this disorder because if it is not managed properly, can result in hypertension. And you should say this. You did not mention the possible complications. No, he should worry. Doctor, you started your real task, after how long? After 1 minute and 40 seconds. Pay attention to the time management. 1 minute and 40 seconds has been wasted in things which are not related to the task. When you were explaining for me the results of his assessment, you talked about the blood test and then you forgot the waist circumference and then you came back to the waist circumference. Waist circumference, this can be considered as disorganized. What could be the reason for this? I asked you what could be the reason for this. You did not answer me. What could be the reason for this? You did not answer.
I answered that there is a lot of reasons. Let me to explore it with you.
So, okay, you explored to eventually what is the reason. So you asked me questions. So what could be the reason? Okay, I don't know. Maybe you are a doctor, you know that, this sedentary lifestyle, etc., can be behind this. But eventually you should answer the question. You don't answer the question by questions. Okay, so
I thought that when I asked you, do you feel that dietary habits play a role in this? And you mentioned yes. And I thought that I attributed my questions to your question.
Okay. So, so please give him a feedback. Today the feedbacks are very, very good. So I hope that they give you some feedback. So let's see according to the mark sheet, to the
There is no feedbacks.
No, nobody wants to give you feedback.
Initially, Dr. Al-Fiki, you could have saved some time instead of mentioning the patient name. I believe you lost around 30 seconds asking the patient about his name. You can have just a short introduction about the purpose of the appointment today. It's the follow-up clinic, the yearly follow-up clinic for the to monitor the side effects of antipsychotic clozapine that he's on, and then move in. This is just one thing. Yeah.
It was not showing the patient name, so it was X. So I thought it's better.
Thank you so much, doctor. It is very helpful, but please make sure that your feedback is on the chat section. It will be very time consuming if everyone chatted with the voice chat. So let's see how we can tackle this task. Okay, so as I always say, you have your plan. Please make sure that this is your plan. You cover these points, and there is an explanation about the management plan in my YouTube. Okay, as I say, you don't need to stick yourself to my plan or anyone's plan, but you should stick to the mark sheet. Okay, eventually you make sure that you score for yourself in the mark sheet enough to make sure that you introduce yourself, as I always say, making sure that you are assertive. Don't mess up with your name or the patient's name, and you should also explain the reason for your talking with the patient, your explanation. So then the first time you should, after that, explain the blood test. Okay, I don't know, you wasted a lot of time. Our colleague explained to you that you wasted time in things which are not related to the task. And then after explaining to him the results, tell him that this is a metabolic syndrome and explain what is the metabolic syndrome. And here is the issue, what is the metabolic syndrome? Okay, this is a simple explanation, which I hope that you pay attention to it, because some of the candidates find it difficult to explain what is the metabolic syndrome. Okay, so it is chemical imbalance as well as a change in the energy consumption. Chemical imbalance and change in the energy consumption. Okay, pay attention to this. Is it serious? Yes, it can cause problems related to the blood vessels, heart, and problem, and diabetes, etc. What is the cause of the metabolic syndrome? Most probably the clozapine. This is how you answer the question. Most probably clozapine. However, there can be other contributing factors. So this is how you answer the question. So primarily, we know that most of the patients who are taking clozapine might suffer from this metabolic syndrome. So you can say something in line with most probably it is clozapine. However, I would like to check for the other contributing factors and ask the biopsychosocial informations which you should ask. And always, doctor, though this is a metabolic syndrome station, please show that you are a safe practitioner and ask about the risk. You might say it is irrelevant, so it is so and so. There is a point about the risk in the mark sheet. Okay, bottom line. The mark sheet is our reference. We are not going to argue about things which will not, this will be an empty argument. Just make sure that you score for yourself in the mark sheet enough to make sure that you'll pass. And then you formulate, as you can see, simple formulation. He has resistant schizophrenia controlled by clozapine. However, he is having metabolic syndrome and it carries a risk on his health if not managed properly. All this in the background of not having any other medical disorders or social stresses. Now, regarding the management, you will follow him up. So the first thing, doctor, you should make sure that you are receptive. So it's not the job of the GP. He is primarily your patient. So you should follow him up in your OPD and to make sure that you are going to do thorough physical and mental assessment. Okay. And also he will need to do further investigations like kidney functions and liver functions and heart tracing. Okay. And then regarding the physical, the care, you have physical follow-up by the GP and so on. Psychologically, everything will be okay. You are not going to change the medication. However, if the metabolic syndrome was not controlled by the non-pharmacological approaches, you might add aripiprazole. Did you talk about the aripiprazole?
No,
Did you mention?
No.
No, please don't say it, please. Aripiprazole is one of the management steps for the patients who have metabolic syndrome, whose metabolic syndrome is not controlled by the non-pharmacological approach. Now, socially, the backbone is to change the lifestyle. We can help him with subsidized gym. Pay attention to this, subsidized gym. And it will also be helpful to book an appointment with a dietitian. Okay, so subsidized gym, dietitian, and alcohol substance misuse services if he mentioned that he has alcohol problem. Okay, so this is how you talk about the management steps. So subsidized gym and dietitian and alcohol substance misuse services. Regarding the medications, everything you will not change the clozapine. It is resistant schizophrenia, but you can add aripiprazole and finally terminate the station. Again, doctor, we are going to have a look at the mark sheet. This is the bottom line. This is how you are going to be assessed. Make sure that when you practice or revise with anyone, make sure that you score for yourself enough to pass in this mark sheet. So did you formulate the station?
No.
So can you formulate it for me rapidly, just picking up the most important points in this patient's condition?
Okay, to recap, there is a side effect from clozapine, and we have to take some steps toward this. You will be referred to dietitian.
No, doctor, formulation is different from management. Formulation that you are highlighting the most important points in the patient's condition, because this will be the foundation of your management. These points in the formulation are the points which you are going to manage. So management is different from the formulation. And really thank you, because you are bringing up what most of the candidates do. They think that the formulation is the management. Formulation is not the management. The patient has a long story. Are you able as a professional doctor to pick up the most important points from all this story, which will be the problem which you think should be managed or no? Okay. 1, 2, 3, show me, please formulate.
Okay. So you are well controlled on clozapine for schizophrenia, but you developed some side effects called metabolic syndrome. And in your condition, to be referred to a dietitian and smoking cessation clinic.
Okay. Again, you are returning to the management. Please, yes. You must differentiate. So this means that the concept of formulation is not crystallized in your mind. Okay, so simply you are going, in the first line, you are going to talk about the main psychological problem and then the level of risk. All this on the background. And when you talk about the background of, you talk about the biopsychosocial information, which you know, or the information which you need to know. Why is that? Why am I going to talk about the information which I need to know? Because this will be reflected on in the management. Maybe I need to know more about his physical condition, so I do some investigations. I need to know more some information about his psychological or social background. Okay, so you talk about the information which you know, or we need to know more about his physical condition or psychological condition. So let's see how we can do this rapidly. He has schizophrenia controlled by clozapine. However, he has a metabolic syndrome which carries high risk on his life. Health is not, if not managed properly. All this in the background of not having any other medical disorders or social stresses. Okay, so we talked about the psychological and also talked about the social everything. So maybe suppose that we need to know more about this. So always we need to know more about his social life or medical problems. So this will be reflected on your management plan. You are going to do some social investigations or psychological or physical investigations. Okay, so the background includes the information which you need to know or you already know. Okay.
Great, doctor. Okay.
Okay, so this is how you formulate. Significance of findings or results. Yes, you did identify this. Adequate management plan. So you did not mention the clozapine, as I said. Did not mention the aripiprazole. This might not be scored for you. This point, so point 1 and 3 might not be scored for you. Does not pay sufficient attention. No, you paid attention. Actually, it was too much. You made it a dialogue which consumed time. Does not develop adequate risk management plan. So they didn't talk about the complications of the of metabolic syndrome, and you didn't ask him frankly if he has any thoughts, any safety concerns about general questions. So all this point might not be scored for you. Psychological and social interventions. Well, I don't know. Psychological here, he needs the aripiprazole and the medications. Social intervention, the subsidized gym. I think this point might be scored for you. It was not very organized because everyone felt that your time is consumed in things which are irrelevant. Other than this, everything was correct. Okay, and it can be disorganized. So this point might not be scored for you. Again, I'm not an examiner, but I'm showing you how to use this mark sheet in order to help you in using it whenever you are going to revise with your study part.
Thank you.
I hope that you found it helpful. Don't get frustrated. We are all here to help each other. Maybe some of our colleagues give you feedback, which can be a bit harsh, no problem. Just make sure that you take the benefit, okay? Thank you so much. Who would like to go next?
Yes, me, please.
Okay. No problem.
Dr. Anuran?
Yeah.
Okay. Assalamu alaikum. So what is your station, Dr. Anuran?
It's NMS.
Neuroleptic malignancy.
Yeah.
Okay, give me just 1 second to put it on the screen.
Yeah.
Okay. Okay, so Ready?
Yeah, what's
want-
his name?
The same, my name, the patient's name is Michael, and I'm his father, and I'll be Mr. White.
Mr. Sorry, what?
Mr. White.
Mr.
Okay, you want to have a look again at the
Yeah, just I'll see the last lines, yeah. Yeah, I'm ready.
okay, great. One, two, three, go.
Good afternoon, Mr. White. I am Nuran, one of the doctors in the mental health team.
Hello.
Hello. My understanding is that you're here today regarding Michael and to understand more about what happened.
Yes, doctor,
really
I'm very
sorry.
worried. They said to me that he is in the intensive care unit. I don't know what's going on with him. Why he is in the intensive care unit? His physically was fit before coming here.
Yeah, I totally can see how worried you are about him and apologize for any distress that happened to you. I can explain to you about a bit further about what happened if you'd like to.
Yes, please do. Please do.
Yeah, so as you know, Michael was admitted about 2 days ago for some struggles with behaviors. He was diagnosed of having first episode psychosis. Are you aware of that?
Well, I've been told this, but nobody mentioned any physical problems. Why is he in the intensive care unit?
So what happened really that he was started on the standard medication, but things were really deteriorated and he was struggling more with his behavior. So there was a risk on himself and on others around him. We tried as a team to calm him down without the need of medications, but it didn't work. So we tried as a second line of guidelines, we tried injection for him. But unfortunately, what happened is that he showed some rare side effect of the medication, and that what needed him to be transferred to a medical unit. Are you following me?
Yes. What is this side effect?
So it's a side effect called neuroleptic malignant syndrome, and that's very rare side effects. It's unpredictable, but it's an emergent medical condition. It's very good that he was picked up very early. He was transferred to the proper setting for him. He was offered all the medical help that he needs. I can explain to you further if you'd like to.
Well, do you you mean that you gave him a medication to cause for him this serious side effect? What did you do? Why did you do this?
So I understand how you're worried about now, and it's really confusing for you. But it's really what happened that he was given a standard medication that helps a lot of patients. It's unpredictable side effect that we wouldn't know about it before he take it.
So what is the cause of this side effect?
It's really unknown cause. It's unpredictable. It comes with no factors that we know of, beforehand. But what happens is that now we know that he shows this side effect, and it's really about that he started to have high fever. He started to become more rigid, more sweating, confused a little bit. It can also cause some incontinence or shakiness of his hands. So he was transferred to the medical unit and he was given proper hydration, proper correction of his salts, a proper monitoring for his bloods, for his respiration, and any other medications if needed, it's also available. How do you feel about that, Mr. White?
Well, you talked about many things, but I'm wondering, are you sure that this neuroleptic malignant syndrome? Could be there any sign, any reason for this presentation?
So he's in hospital. He had been really assessed and evaluated by different team members, and it's most likely that he developed the side effect of neuroleptic malignant syndrome, and he's managed very well currently. Do you feel that sense to you?
Yes. So how is he doing now?
Well, he's currently, we are following up with him. We are seeing him regularly. He's, as far as I know, he's managing better. He has been caught up very early, so we're trying to prevent any potential harms to him, and things hopefully progress well. I would like to tell you that there is a fatality rate of this side effect, but hopefully for Michael, the things are going better now.
So you want to say it is a serious condition?
It's a serious condition, yeah. But the good news is that he has been caught very early. He was in a hospital setting. He was taken to the proper setting for him, to medical unit. He was seen by different doctors and professionals to offer all the help needed.
Well, do you think that is he going to get better?
So currently, as far as he shows, there's a good prognosis and good indications for what he shows. But there is a risk of fatality in NMS or neuroleptic malignant syndrome. It's about 15 to 20%, but the other 18% patients, they can make it and recover from this side effect. Hope that's clear to you.
I see, doctor. So how I want to set a complaint against you and the medical team.
I'm really sorry for all happened. I'm really sorry for the distress that you are in now. If you'd like to progress with the complaint, I can give you a contact number for PALS, which is the Patient Advice and Liaison Service. And maybe you would like to contact them. And I know that they look into every complaint very professionally and they do provide help if that's needed. Are you happy with that, Mr. Roy?
Well, what are you going to do to help him? 1 minute remaining.
So currently, physical health is a priority. We need to stabilize him physically first. And once that happened and he's more able to be back to the mental health ward, we're going to get him back, make an assessment for risk, make an assessment for his mental condition and medical condition as well. And then we have a discussion about the medication that he will benefit from. There are different options of medications, maybe reducing the current medication if he showed response or trying alternatives. And there is also other psychological and social interventions. So we all work as a team together. How do you feel about that?
Yes, it sounds helpful. Yes. So how do you know if he is going to get improved?
So we are following him. I do see him very regularly and other members of the team as well. We do liaise with the medical team and we do monitor for any risk or any mental health problems that happen during being in the medical unit. How do you feel about that?
How are you going to prevent this from happening again?
So that's really difficult question. I can't say that I can prevent this happening again. So there's a high risk of recurrence. What I can do that we are very mindful, we will document that in our notes in the system, and any medications given to him will be gradually and very slowly introduced to just minimize any harm can happen. And that can be a risk, but we are very mindful about it.
Okay, time. How do you feel about what you did?
I think I tried.
Okay, very good, very good. I will give her some feedback, please. Now, when I ask you about the cause, you talked about the symptoms and the management. Why didn't you talk about the chemical imbalance behind this, particularly a substance called dopamine, and which is related to the psychiatric disorders, and that's why this imbalance has happened because when he took the medications. I don't know why did he talk the good prognosis. Why did he say good prognosis? He said prognosis. Prognosis is a medical jargon that with good outcome.
Okay.
When I ask you about whether he's going to get better, I expected from you to talk how you are going to know if he's going to get better. I expected from you to talk about the CPK. How are you going to prevent this? Your answer is good, but you started the answer with a very worrying sentence that it is not prevented, and so you gave him gave me an impression that this will happen again definitely. No, it will not happen as long as you are going to start with a small dose with a medication like aripiprazole, which is less liable to cause this side effect and so on. Okay, so let's see she did mention the mortality rate of nice not psychiatrists, but the doctors and intensive psychiatric years of often medication has been stopped. Niche. Okay. Let's see the feed our what is yes. Yeah, it is. As you can see, that you are going to get a lot of questions from the role player. Maybe it will be just a dialogue, and most probably you are going to be led by his questions. A lot of questions in this station. Okay. But make sure that you show empathy. You are going to meet a role player who will be very concerned, and he will be defensive if you did not pay attention to his feelings, okay? He is supposed to be acting as if he is a father of someone who is in the intensive care unit. So pay attention to the emotional response to what he is going to say, okay? Yes, your explanation, introduction, you did your introduction very good. Then your explanation was nice. You talked about the medications called antipsychotics, and he was giving an antipsychotic, an additional dose of 2 ampoules of haloperidol, which to control his agitation, and eventually he developed this side effect. Have you didn't please mention? Well, it is difficult, I know, but pay attention that it will be nice to mention that there's some sort of statistics which 1 every 100, just to emphasize that it is a rare side effects. Okay, why did you give him this medication? Please pay attention to this answer, please. The pros and cons of giving haloperidol, okay, made you take this decision. The side effect is totally unpredictable. On the other hand, the patient is agitated, and haloperidol will control his agitation and calm him down, and this agitation causes for him serious problems. Okay, so according to the pros and cons, the best course of action was to give him haloperidol. Okay. What is the cause of this side effects? Please mention that primarily we know that it is a chemical imbalance, primarily called because of the dopamine. So please mention. Could be there any other diagnosis? I mean, yes, there can be confusion due to medical disorder or severe infection, confusion to another psychiatric disorder, confusion as a side effect of other medications called serotonin syndrome, and toxicity. However, because of the temporal relation between the symptoms and the onset of the antipsychotics, as well as the clinical presentation, most probably it is a neuroleptic malignant syndrome. Pay attention to this. Could be there any other diagnosis? How is he doing now? Now, this is a question which is a bit tricky, because pay attention, doctors, please. In the station, you are going to go to Sheffield now. In the station, there will be a paper attached, green paper, attached to the chair. In this green paper, you will find the chart which you usually find in your file sections in the nursing staff of the patient's vital data. Okay? Are you all following me? The patient's vital data will be present in this green paper attached to the chair. So when he asks you, how is he doing now? Simply read the vital data of the patient in this, which is written in this green paper. Okay, is it a serious condition? Yes, there are fatalities between 5 to 20, 15 and 20 according to your source, but there are fatalities. And don't duck, just fade. Unfortunately, neuroleptic malignant syndrome is a serious condition if not managed properly, and the mortality rate ranges between 5 and 20%. Is he going to get better? Okay, now this is a question about the prognosis. in order to make sure that you address it quite well. Just have a background about the patient, if he has any medical problems, if he has any previous contact with psychiatric services, and I will tell you why these questions are there, and if there are any social problems, stresses, and any risk. Now, the prognosis here is about two things: the neuroleptic malignant syndrome and his original psychiatric disorder. Now, regarding the neuroleptic malignant syndrome, the treatment depends on the medical condition of the patient before the onset of the clinical picture. Doctors, I want you to answer in a way which is different from these commercial notes which you have. If the candidates pass with me, because they have different answers which are a bit professional. So you want to talk about the prognosis of the neuroleptic malignant syndrome and the psychological condition. The neuroleptic malignant syndrome, the prognosis is primarily depending upon the medical condition of the patient before the onset of the clinical picture and the early start of the treatment. Okay, and the good news is that this disorder was early picked and managed, and the management has started as soon as possible. So this is the prognosis or the outcome of the neuroleptic malignant syndrome. As for his psychological condition, we know that it depends on the past history of psychiatric disorder, the early start of the treatment, the past history of substance misuse, and absence of stresses, and good family support. That's why before answering this question, okay, I asked about the information which will help me to answer the prognosis. I want to set a complaint. You answered it properly. Okay, formulation, how you are going to help him. This is the typical question which you are going to be asked before talking about the management, and the best place to talk about the formulation and to show that you are able to formulate is immediately before talking about the management. Okay. Having said this, please, doctor, can you formulate first line, what is the main psychological problem and what is the risk? All this in the background of. Please formulate, doctor.
So Michael is presented with first episode psychosis. He was admitted for about 2 days ago.
Doctor, this is a historical detail which has no value. The first line is the main psychological problem on what is the level of risk. That's it. When was he admitted, the type of symptoms, all these are historical details. So this is a clinical skill, how to formulate. That's why it needs practice. What is the formulation again, Doc?
First episode psychosis.
Yes.
There is a level of risk of agitation and not controlled. He was given haloperidol injection, but developed a side effect of neuroleptic malignant syndrome.
Doctor, you are going through historical, dear doctor, you are going through non-essential. There is no importance of these historical details in the formulation. He developed neuroleptic malignant syndrome. Definitely, there is a reason behind this, which you have discussed. Okay, thank you so much. This emphasizes that there is a defect in the candidates, though you are professional candidates. Reaching this level of your career means that you are already professional and knowledgeable, but unfortunately, formulation is a skill which needs to be practiced. You can, doctor, say something on the line that Mr. X has first onset psychosis, the first episode psychosis, and has developed neuroleptic malignant syndrome, which carries considerable risk on his life. All this on the background of having no other underlying medical disorders. There is a positive history of substance misuse, substance dependence, and a positive history of psychiatric disorder in the family. Okay, if he says that there is something like this. Okay, so this is how you formulate. I hope that you got it, doctor. And if you did not understand how to formulate, please watch the video of explanation of the formulation. Talking about the management, again, start by what are you going to do and where the patient is going to be treated. Okay. The patient is going to be treated in intensive care unit. You will liaise with the physician and you will update the father about the condition of his son. The investigations, okay, the patient needs to do blood tests like CBC, liver function test, kidney function test, etc. Then there will be a team who will follow everything which you have just mentioned, but pay attention to that you must mention some medications which will reflect that you are a bit professional also, that we use some medications sometimes like dantrolene and bromocriptine, okay, which will help to decrease the muscle tension, okay. There will be the haloperidol must be stopped. You must control the vital data, okay, and if there is any agitation, you can use benzodiazepines to calm him down. Okay, psychologically, okay, this is the benzodiazepine rule. And when the physical condition is stable, you are going to transfer him back to psychiatric side. And the neuroleptic malignant syndrome is going to be documented. And you will start him on an antipsychotic, which is less liable to cause serotonin syndrome like aripiprazole. This is how you talk about the managed doctor. I felt that it was very defective plan. Okay. And termination, giving him some leaflets. Is it clear, doctor? Any questions? The medical care, control the vital data, giving him medications to control the muscle breakdown like dantrolene, bromocriptine, okay, and when his physical condition and fluids, when his physical condition is controlled, he is going to be transferred. If there is need for controlling of agitation, you are going to use benzodiazepines. Okay.
Thank you so much.
I hope that you found it helpful. I'm not going to go through the mark sheet again, doctor. It is weak time consuming. Okay, so thank you, Dr. Nuran. Very clear.
Thank you.
Let's see the feedback of our colleagues. Can I go next? Can someone share the YouTube link? YouTube link for what? Okay. Why does the outcome of neuroleptic malignant syndrome depends on the psychological symptoms? I don't know what I didn't say that it depends on it. It primarily depends on the medical condition of the patient. Okay, so who would like to go next?
Yes, please, doctor.
Amr Hafiz or?
Yes.
Amr Hafiz. Yes, doctor, what is your station, though?
Manic patient not controlled by olanzapine.
A manic patient not controlled by olanzapine?
Speaking with the ward nurse.
Yes, أيوة الممرضة الرخم. Yep. Okay, Dr. Demiana, you will go after Dr. Ab. Okay. Doctors, because I did not record the first station of morbid jealousy, if anyone wants to do it, no problem. At the end of the stations, we are going to do the morbid jealousy. Anyone wants to take it, please write his name in the chat section. The morbid jealousy, which the very first station which we did.
I'm ready.
Very clever, mashallah. Just put down 1, 2, 3, go.
By the way, what is the name of that? I'm sorry. But what is the name of the nurse and the patient?
Let's say that the patient's name is Robin, and the nurse name is Kelly. Kelly, 1, 2, 1, 2, 3, go.
Hello,
Hello, doctor.
my name is Dr. Hafiz, one of the psychiatrist team. Are you Miss Kelly?
Yes, yes, yes. Thank you for coming, doctor. I would like to discuss with you the patient condition of one of our patients called Robin, please.
Okay, you can go ahead.
Well, I would like you to consider changing his medications because he's totally not cooperative. The consultant has assessed him, and he said that there is a place to change the medications if he is not controlled.
Okay, so thank you for sharing your concerns. I understand that you are talking about patient cold.
Yes, yes, his name is Robin, actually.
Yes, and I can see from my note that he is a bipolar mood disorder patient, and he is currently in manic states, and he is in the psychiatric ICU. Am I correct?
Yes, yes, yes.
Okay. I can see how much you are caring about the patient, but in the beginning, I'd like to ask you some questions about him. Is that okay with you?
No problem. No problem.
Okay, great, thank you. Would you tell me in the beginning what is the medication that he is taking currently?
He's taking olanzapine, or you can say he's hardly taking olanzapine.
What do you mean by hardly? Isn't he cooperative?
He's not cooperative at all, doctor. He does not want us to give him the medications, and sometimes he hides the medications.
Okay. And what about the dose of olanzapine?
He's taking 10 milligram now.
Okay. Is there any side effect for him regarding olanzapine?
Well, actually, I cannot tell. He took it for 3 days, and I doubt that he was taking it regularly, so I cannot tell.
So he's taking it for 3 days now.
Yeah.
And you just mentioned that he is uncooperative in the ward.
Yes. Yes.
Is there any impulsive behavior?
Well, he is not impulsive, but I feel that he is very, very irritating to the staff and the other patients. He's intruding their personal spaces, using their items sometimes, sharing with them their food, sometimes wearing their clothes. So you can see that these are things which we know can cause serious problems for the patients.
Yes. I can see also that mostly he is distressing for you all as a nurse. I'd like also to ask you about if there is any ideas of harming others or violent behavior.
Not so far, doctor, but who knows? We don't want things to escalate.
Sure, sure. And what about ideas of harming himself?
Well, no, he doesn't harm himself.
Okay. Is there any history for substance use?
I don't know, actually.
Or alcohol?
No, we don't know.
Do you have any idea if there is any medical history?
Well, we tried to take vital data regularly, but he's not cooperative. Even in blood tests, he did not give us the chance to do his blood test.
So he is not cooperative regarding the investigations?
Yes, yes.
What about the ECG? Yeah. Has it done already?
No, no.
Okay. So he's not taking any other medication rather than olanzapine?
Yes, yes.
Okay. So thank you for sharing all this with me, Ms. Kelly. I would like to know, you told me that he is taking olanzapine for only 3 days.
Yes.
I can see that this period, only 3 days, is not sufficient to see the effect of this medication, olanzapine. And all other medications, including any antipsychotic or mood stabilizer, need about 5 to 7 days to see its effects. How do you feel about it?
Well, doctor, the consultant has assessed them, and he said that if the olanzapine did not bring any improvement, we can consider lithium. And I hope that you add for him lithium, because it seems that olanzapine is not helping at all.
Okay, thank you for this. But let me tell you that you just mentioned that the investigations that he has that is needed for him is he is not cooperative regarding it, and he has not done it yet. Am I correct?
Yes.
So as you know that lithium, if we need to add lithium, we have to do some tests before adding lithium, and even during taking lithium, some investigation needed to be done. And as you said, he is not cooperative regarding this.
Yes. No. Yes. Yes.
So I feel that we can add some medications like benzodiazepine to make him calm and more relaxed these days.
Okay, this can be helped. So how can we help him then, doctor, if you are not going to change the medications?
Okay, thank you. I would like to highlight some important points about Mr. Coben regarding some points important for his management. I can see that he is bipolar mood disorder. He is currently in manic state, and we need to do further history taking about his past history, about history of substance use, and family history and past psychiatric history. I need to see Mr. Coppen by myself. Is that okay? And
Yes.
and also I need to do some investigation to follow up the investigation that.
1 minute remaining.
Okay. Moreover, we can involve him in a multidisciplinary team to follow him physically regarding his physical condition.
Yes.
And psychologically, we need to increase the dose of olanzapine if he in need for it. And we need to wait for some time to see the effect, and we might need to increase the dose of olanzapine. If there is no effect, we can add some medication, some other medications like mood stabilizer, and later on we can change it even to reach ECT. Am I clear?
Yes. Yes. Doctor.
And also we can add some medication like benzodiazepine to make him more calm and relaxed these days. Am I clear?
Okay.
So, and also we can involve him with substance misuse if it is proven that he is taking substance before.
Okay, doctor.
Is that okay? Do you have any questions right now?
No, thank you.
You're welcome. Thank you.
Time. How do you feel about what you did?
I tried my best.
Yes, you tried. But give him some feedback, please, doctor. Give him, first of all, chunk and check, please. Chunk and check. Number 2, once you find that you are talking with a healthcare giver, now you must understand why it is a healthcare caregiver, not someone else. Maybe he can be his father or the wife talking to you about changing the medications with lithium, same scenario. So the first thing you should do is to pay attention. With a nurse or a healthcare giver, you must take a handover. Pay attention to this handover. What does it mean? What is the handover? Say frankly, I would like to take a handover from you about the patient. Say it and verbalize it. I want to take a handover. What is the handover? The biopsychosocial information plus the management steps taken so far. So you want to know all the physical information about the patient, all the social, all the psychological, plus what are the management steps taken so far, because this is a healthcare giver, be a nurse or doctor or whoever is the patient or the role player. But pay attention, you must take a handover. Are you with me, doctor?
Yes.
Please, I know that you are translating from Arabic to English. This feedback from someone who is native English. Don't say let me. Okay. You can say something like I would appreciate to discuss with you, so and so. Don't say let me. So you can get the response, I'm not holding you. Why do you say it let me? For them, let me means that this man is not giving you the chance to talk and he is not very polite in the way he's talking. Please chunk and check, avoid the lecturing. Let's see the feedback of our colleagues. I can see, okay, Mustafa. I can do, yes. Okay, Dr. Santos. I think he meant to say. Okay, so Pedro, yes, he did not talk about where the patient is going to be admitted. So let's see the PDF. Again, doctor, it's not a must that you follow my PDF, but it is a must for every one of you. to make sure that his reference is the mark sheet. Manic patient. Manic patient, yes. So let's see. Okay. Okay, so pay attention to that. When speaking to a nurse, you take a hand over the biopsychosocial, the risk, and the management steps so far. This is how you start the station, taking a hand over and verbalize it that you want to take a hand over. This is how you start your discussion with the nurse, okay? And definitely the nurse will express the difficulties which she's having with the patient. Show empathy, any sentence to show that you understand your concerns regarding your patient. I'm here to help you, anything in this line, but you must show the appropriate reciprocal emotional interaction, okay? Otherwise, you will be considered to be formal. So this is how you gather the biopsychosocial information. This is the handover, and finally, the management step. You ask about the particular, it was a very closed-ended question. So did you do for him urine drug screening? I guess you asked this question. You ask about the heart racing. Just ask one simple, what are the open-ended question? What are the steps taken so far in the management of this condition? That's it. Other than this, you don't need to ask in details about everything.
Okay.
Now, in this station, definitely in every station you will have an issue which will challenge your communication skills. So this is a nurse who is arguing to start lithium, and at the same time, lithium is not the best medication in the patient's condition. Okay, she will ask you, she will request to start lithium, and then your best answer is to just, I appreciate your opinion. I would like to discuss it with you. Are you okay with that? Okay, and explain why lithium is not the best medication, but this is how you start. I appreciate your opinion. However, I would like to discuss it. Are you okay with it? Lithium requires the weekly blood test. Moreover, the patient must be cooperative in taking it. Why is that? Because this will help in keeping the levels in the therapeutic range and will avoid the side effects. Do you feel that this applies on Mr. X? Show that you have this collaborative approach, not lecturing, okay? Also, the olanzapine is very effective in controlling the symptoms. However, it has been given only for 3 days, which is not an enough duration. In addition, there is still a room to increase the dose. Did what I said make sense? Okay, this is how you answer this question. If you did not answer the question properly, as far as I know, the nurse became defensive and you lose the station. How can you help him? You formulate. So please formulate, and this will be the last time to do formulation. Just to understand how to do a formulation other than this, please watch the explanation in the YouTube channel. So please formulate, doctor. The first line is the main psychological problem, the level of risk, and the second line is the background information which you know or you need to know about the patient. 1, 2, 3, go.
Okay. Mr. X is, I do understand that Mr. X, I would like to highlight some points that is important for the management. Mr. X is diagnosed as bipolar mood disorder, currently in manic state. He is not cooperative, and he's resistant. He has a high risk right now, and I need to collect some more history about the past psychiatric history, about his history of substance use, family history, and
Excellent. So with time and practice, he will formulate more fluently. Now, regarding the management step, and I always say, make your talking about the management step very organized, because when you start talking about the management steps, most probably only 1.5 minutes will be left. You don't want to waste time because of this organization. So the first thing is, what are you going to do and where the patient is going to be treated? This is the first thing which you are going to talk about. You are going to see Mr. X yourself to do a mental state assessment, physical assessment, and Okay, and thorough risk assessment. Thorough risk assessment is not named risk assessment. Okay. Also, I would like to have a look at his past psychiatric history and the medications which he used before. Show that you are a receptive doctor. You are not going to triage the patient here and there, and you as a doctor don't do anything. And where the patient is going to be treated, okay, the patient should stay in the psychiatric intensive care unit under one-to-one observation, and he can have a leave under supervision for 1 to 2 hours. Okay. There are important investigations to be done, the routine investigations in addition to the urine drug screening. So the first thing is, what are you going to do? Where the patient is going to be treated. Number 2, the investigations. Number 3, the team which will cover all his needs, physical, if there are any physical problems according to the clinical assessment and the investigations, are going to consult the physician. The psychological, the medications, a short course of benzodiazepine is essential here because you need to calm the patient. Why? And to improve his sleep pattern. If the manic symptoms are not controlled by 10 milligram olanzapine and the benzodiazepines, the dose of olanzapine can be increased to 20 milligrams. So this is the stepwise approach. First thing, you are going to add benzodiazepines to calm down the patient. You will keep him on 10 milligram olanzapine. If there is no improvement, you can add another 10 milligram. So the total dose will be 20 milligram. The second step, if there is no improvement, okay, you can add another mood stabilizers. And if there is still manic symptoms, you can use either clozapine or use the electroconvulsive therapy. So this is the stepwise approach. Okay, are you with me, doctor?
Yes.
Okay, again, you'll keep him on 10 milligram and add benzodiazepines. If there is no improvement, you're going to increase the dose of benzodiazepine, olanzapine. Still, there is no improvement, you can add another mood stabilizers, okay? And if there is no improvement, you can use either clozapine or electroconvulsive therapy. And you must mention that ideally the medications should be tried with enough dose and duration before changing them. Just mention this sentence to show that you're professional, you're not going to change the medications every time you see the patient. Okay, what is the social approach? The input of the substance misuse will be helpful if there is any underlying substance misuse problem, okay? And finally, you must talk about the discharge. When the mental state of the patient is stable and the risk is low, we can plan for the discharge and also a committed treatment order to prevent the relapse. Okay, so this is how we talk about the biopsychosocial steps of the management. And finally, terminate the station with giving him just thank for this valuable handover, and I will leave my contact number and so on. Is it clear for you, doctors? I know that this can be a non-conventional approach according to what you have in your hands in the notes, okay? But they said that they have high expectations from the candidates. This is a clear sentence from the Royal College when they are talking about the cost. Their expectations from the candidates is high. So make sure that your approach also will be on this level.
So I have a question. Actually, 2 questions. When I say to him that I need a handover, he will say everything, right? And he will not be surprised by any.
No, you say the handover. This is an open-ended question, and then ask him, tell me more about the social circumstances, the circumstances of admission, how he is doing or in the world. So this is the social, the psychological, the physical. Show the examiner that you know how to talk with a nurse when he is discussing with you about the patient. The first thing is that you want to take a handover. How are you going to start the talk with the nurse? Say it, a handover. I want a handover. These are information which are not written in the notes which you have. Say that I want a handover. Verbalize it.
Okay. The second question, the last question, I need to talk about the next step The long next step, which is clozapine and ACT and the discharge, while we are talking right now about
Well, very
conditions.
good question. Actually, again, our reference is the mark sheet. Okay, as you can see, adequate management plan, which reflects knowledge of the current best practice. So you must know that there is a stepwise approach. So is it your manager, are you going to keep him on olanzapine and benzodiazepine? What if there is no improvement? So this is the point here about the best practice. And for me, there is no way to tackle this point except by showing that you know that there is stepwise fashion in your approach with the medications.
Okay, thank you.
Thank you so much for your questions. Okay, I hope that you found it helpful, very clever. Who would like to go next? I think it's Dr. Demiana. This is Dr. Demiana. I think she said that she wants to.
Yeah.
Yes. How are you, doctor? So what is your station, doctor?
Pediatric overdose.
1 minute. Yeah. Oh, Jesus Christ. Oh, man. Oh. Yes, Dr. Luther, I see a brief or more professionally to say I want to take a handover about the patient, not a brief. Okay, that's it.
Yeah, doctor, I can start.
Okay.
How can I call you?
Let's say that my name is Robin. I'm the nurse who is
Robin?
going to discuss the
Yeah.
condition. Okay. So
What's the name of the girl?
Michelle. Okay. Okay. Let's see. 1, 2, 3. Yeah, mashallah. Go. Yes.
Good afternoon, Robin. I'm Demiana, a
Hello.
psychiatrist at mental health team. How
Hello.
are you? My
Well, I'm fine,
understanding.
but I'm really troubled with this patient, Michelle. She is really disrupting my word. And actually, you know, there is no place for her in this place. She is already cleared from this suicidal attempt, if it is a suicidal attempt. And I hope that you take her to your psychiatric side, please.
Yeah, I understand that you are loaded by too many tasks. I appreciate that, but I would appreciate also if you took me through what happened and tell me what's your background about the situation, if you don't mind.
Well, she has been, there are some allegations that she attempted suicide and she is now medically cleared. And I hope that you take her because her mental condition is not stable.
Yeah, so she's medically cleared at the moment.
Yes.
And how do you notice about her in the word?
Well, doctor, she is disrupting the word. She is talking about some allegations against her staff, about her stepfather. Sometimes she's talking to herself. She wants to leave the place. So we, you know, we are not trained to deal with this type of patients. So I hope that you understand that we did our job. Now her place is in your side. I hope that you transfer, please.
I appreciate your concern, Robin, but could you tell me if she sounds that she's eating well, she's sleeping well?
Well, so far, no problem with that. No problem with her eating or sleeping. But sometimes she screams. Sometimes she screams. I don't know why. And actually, she just pull her hair, and then you know this behavior definitely makes all the other kids on the edge.
And did any one of her family visited here recently?
Well, her stepfather wants to see her, and again, this is an issue which I would like to discuss with you. Can we allow him to talk with her? I don't know, actually.
So, Robin, Michelle admitted to your word after a trial to end her life, right? And
Yes.
she is now medically cleared, and you don't have any other information about her.
Well, this is regarding my job. I don't need more than this. She is medically cleared, and I think she should be transferred.
I can gather from the note that she held the paper which was a rape was written on it, right?
Well, I don't know anything about this, doctor.
Yeah, I can gather that from the note at the moment.
Yes.
Did you explore for that, or did you have any idea about that?
No, no, it's beyond our scope.
Yeah, actually, we work as a multidisciplinary team and we follow a holistic approach. We have many lines of treatment. We have a short-term plan, Robin, and a long-term one.
Well, I understand, doctor, but okay, your plan should be implemented in your ward. Because medically, she is now in no need for our side. She is stable medically according to the investigations and the clinical assessment. I hope that you understand what I'm saying. I don't want to be rude, but really her place is not here.
Yeah, what about asking for help for a psychiatric nurse at the moment until it will be available for you
well,
to...
Well, what is the problem if she is in your side?
Sorry?
What will be the problem if she is in your side?
My understanding...
If she needs a psychiatric care by a nurse, a psychiatric nurse, so why don't you take her?
My understanding, there is no availability of beds in the psychiatric ward, right? And we need to do further assessment for her because my understanding, she came to your ward after taking an overdose of medication. So I have to see her myself in the ward, assess her.
Yes, doctor, but you know, really, her presence in our side is not very comfortable for the treating team and the nursing staff. It is a type of patient which is totally beyond our knowledge and training. We are not trained to deal with this type of patients.
Yeah. What about making a triage for patient to see the priority of patients which need admitted to your ward? And our priority at the moment is the safety. We have to contact the social services and social workers to be sure that the situation is safe for Michelle to be discharged from your ward. This is one thing. And we also need to meet Michelle's mother because we have to explore more about what happened and why she is afraid from her stepfather who was outside because she is the responsible person for her.
Well, do you think that we are going to inform her mother?
We have to inform him and to inform Michelle that we have to.
So you are going to inform her mother?
We should to explore more from her mother and not to contaminate the evidence about that so as not to disturb the circumstances, right? But we have to make sure that Michelle is safe. This is our priority at the moment. She's coming after taking an overdose, so we have to be sure that she is medically stable at the right time as well.
1 minute remaining.
Yeah, and on the long-term plan, all what happened and led to this taking overdose may affect her emotionally. So we have to consider psychological treatment to support her emotionally as well. What do you think, Robin, about that?
Well, this sounds to be helpful.
Yeah, another thing, that involvement of social services to revise the situation in her home to be sure that everything is going to be safe for Michelle, because if not, we need to search for alternative place. Other siblings in the home also, we should pay attention to them because they may expose to risk at the time. So we have to consider it in our plan. How does it sound for you?
It sounds very helpful, yes.
Thank you for talking to me, Robin. I know that it was a difficult time for you. I appreciate this.
Time. How do you feel about what you did?
It's my first time to see this station. I tried my best to.
First time
But,
to see the station. Why didn't you prepare?
I searched for it and I didn't practice it, so I searched for it. I saw it before the session, but I didn't practice it before. That's what I mean.
Okay, so let's see. It was not very good performed, by the way. So a lot of feedback actually. I stopped giving you feedback actually. So the thing which you wanted talking about the paper, there is no. You ask him, do you know that the paper? I don't know why did you say this. Let's go through the mark sheet. Let's get feedback and yeah, let's see the PDF. Actually, the feedback will not be of any value because please doctors prepare. Okay, so this is how you do the station. This station are going to meet a role player which is a bit defensive because he doesn't like the presence of the patient without any medical problems in his side. And you have two versions of this station. One of the versions is that she has been raped by her stepfather. The other version that this girl is totally psychotic and she has a paper thinking that the aliens has raped her. Okay, so whether this scenario or this scenario, it's no big difference. But when you get the same scenario with a girl telling you saying to you that the aliens has raped her, don't get perplexed. You will find the same plan fitting the approach. Okay. You introduce yourself. The role player expresses his stress from the presence of the patient in the ward. Show empathy. Okay. And again, start by taking a handover, please, doctor, and say it. I want to take a handover. I want to know more about what is the problem of the patient, what is the patient, and what are the problems caused by the patient. Okay. Pay attention that she is already medically cleared, so no need to ask about the medical problems. This girl is already medically clear, so all what you need to do is to ask about the social, the psychological, the risk, and the handover, which are the management steps taken so far. Regarding the medical condition, it is mentioned in the notes that the patient is already medically cleared. If you ask again about the medical condition, this means that you are not professional and you do not pay attention to the information given to you. Pay attention to this, though, okay? You want to know more about the difficulties, social, the difficulties which she is having in the ward. Is she cooperative? Any information about her life circumstances in general? Psychological, ask about hallucinatory behaviors, sleep and appetite, okay? And then the risk, you must ask about the risk because this is a suicidal attempt and you want to know if there are any safety concerns. Having said this, Dr. Demiana, did not ask any question about the risk, okay? And finally, ask about the management steps taken so far. Pay attention to the mistakes which Dr. Demiana did, because these are the typical questions which, from my experience, which the candidates do. No one asks about the risk. You just ask about the psychological, social, and then don't ask about the risk. Though it is a suicidal patient, okay?
What about, as regards the risk, can I ask about the current thoughts to harm herself again or something like that you mean? Or what do you mean by risk in this patient?
Can't you see the PDF I have gathered? It is written here, I've gathered from the notes that she is medically stable at 100. If you have any concerns about her safety, how about the safety of others? Just say 2 questions about the risk, no more.
Yeah. I see. Yeah, I got it. Thank you.
Okay, so explanation. Then you explain to him what is the problem, okay? You want to explain to him the problem of the patient, that she has severe depression, okay, and she has attempted a serious suicidal attempt, and she needs an extensive management for her mental condition. Okay. In addition, there are allegations. This is the part which can be a bit confusing. There are allegations. We don't know yet I don't know all the notes that it is serious, and maybe she is psychotic, and all what she is talking about can be some sort of psychosis. That is nothing like this. So talk about allegations. Don't talk about the rape as if it is a serious fact. Talk about that it is a serious allegation. That's it. And you are going to take the appropriate steps. Okay. In addition, there are allegations against her stepfathers, some which need to be assessed before letting her go back home. Okay, all this we are in the context that we are explaining for the nurse the condition of the patient. And in addition, there are no available beds in the psychiatric wards. Okay, are you with me, doctor? So the first thing that we did, take the handover. Next thing, we explained for the nurse the condition of the patient and the associated circumstances, that there are serious allegations and there is no available bed in the psychiatric wards. Now he's going to now this is again, this is the part which you are going to which will challenge your communication skills, exactly like in the station of the manic patient whose the nurse wants to give him lithium instead of olanzapine. So this is the part of the dialogue which challenge your communication skills. So he will express his discomfort from your decision to make the patient stay in his ward. I understand how much busy your ward is and the difficulties you are having in taking care of Miss X, and your concerns about her presence in the ward. However, I'm sure that together as one team, we can help her to pass this critical period. Rest assured, I will do my best to sort out your concerns in the management plan. How is that? There will be a psychiatric nurse with Miss X in the ward who is experienced in managing her condition, and I will assess her regularly, and I will have a meeting with the nursing staff to explain her condition. And once there is an available bed in the pediatric ward, she will be transferred. Okay, so this is how you argue against his insistence to take the patient out of his ward. Any question, doctor, regarding this approach? Are you with me, doctors?
Yeah, Dr. D.
Okay. Just some mistakes I put here and there. These are some questions which you are going to get. She tries to leave the ward. You have the right to keep her according to the Mental Health Act. Her stepfather wants to see her. Okay, so when he says to you that her stepfather, these are the two questions which you are going to get and which the candidates find it difficult. Her stepfather wants to see her, and can we inform her mother? Regarding the stepfather who wants to see her, you can say something in line that according to the serious allegations from the history taken from Miss X, it is not allowed for him to communicate with her. However, he can book an appointment to talk with one of the team members. That's it. Okay, don't talk about the contamination of evidence and this big words which actually do not add anything in your assessment, by the way. Now, can we inform her mother from the story that the mother is in a psychiatric hospital? So this is a serious question. Can the mother be informed with the condition of her daughter and the circumstances and the allegations? Okay, can say something in the line. The incidents and the details are very hard, bearing in mind that her mother has depression and is admitted in a mental health hospital. I need to discuss, or I would like to discuss this point with her treating team. Okay, I would like to discuss this point with her treating team. Then how we can help her? Do your formulation. Having said this, please formulate, doctor.
I formulate. Would you like me to? Sorry, doctor. Would you like me to formulate the case?
Yes, please formulate.
Yeah. We can say that just to highlight the important points in the situation, Michelle presented to hospital after a serious suicidal attempt. There is allegation against her stepfather. There is no background to prove that there is any medical condition. We have to assess her psychological state.
You have started in the management. Okay, so you can say something that she has. The first line is the psychological problem and the level of risk. She has depression, has attempted serious suicidal attempt, and she is now medically stable. However, there is still a high risk on her. All this on the background of allegations of sexual abuse against her stepfather. You must talk about allegations. You don't know yet if it is a true fact. Don't talk about this issue as if it is a fact. Be professional, doctor. All the notes which you have are talking about it as if it is a serious fact. Why, I don't know. All this on the background of allegations of sexual abuse against her stepfather. She has no past psychiatric history, but there is a positive family history of psychiatric disorder in her mother, who is suffering from depression. Okay, and then regarding the management, okay, in the exam, you are always a court trainee. Some serious clinical situations must be raised to the consultants. Okay, pay attention to this, doctor. This is a place in which you must mention that you are going to share your seniors. You are not here as a consultant. I know that the management is a bit complicated and it needs some explanation, but bear with me because, as I said, the management has a very, very low pass rate. The first thing, what are you going to do and where the patient is going to be treated? As we said, the patient is going to be treated in the medical ward, but pay attention that must say something in line because of the high risk and the seriousness of the allegations. I would like to discuss her condition with the consultant and with the forensic psychiatric team. Also, I would like to see Ms. X again to explain her diagnosis and to address her concerns and to do a thorough risk assessment. You already mentioned that she's going to be treated in the psychiatric ward and you're going to follow her up and there is a nurse. There is no place and time to repeat this again. Okay? If you have time, you can repeat it, but please pay attention to the time. Okay, once there is a vacant in the psychiatric wards, she can be transferred. The investigations are already done. However, I would like to double check. Then the management, the biopsychosocial, okay. Let's see, the treating team, okay. As for the allegations and bearing in mind the possibility of the presence of other children at home, I would like to make urgent referral to social services and inform the child protection officer and the relevant agencies and the police as well. So this is the social approach. The psychological, the medications, short course of benzodiazepines, and in case of underlying psychological problem, you are going to use a benzodiazepine. Or when you talk about the antipsychotic, mention an aripiprazole because it is considered to be the best antipsychotic in the small age group. Not open-ended, not any antipsychotic. Likewise, when you talk about the old age group, you must mention that we should better avoid the olanzapine and risperidone because they are associated with strokes, okay? Ms. X will find great help also from the talking therapy. So this is the social and psychological. So where is the physical? She is already in the medical ward and she is physically cleared. So what is remained in your approach is the social and the psychological approach. And finally, the termination. Okay, doctor. I know that there are some points which you don't find in your in the other notes which you have, but here you have it here in the PDF. Okay, so who would like to go next?
Can I go, doctor?
Yes.
Thank you.
Why do we involve the forensic psychiatric team? Doctor, it is the forensic, the allegations. We must discuss this with the forensic team. So who are you going to discuss this with? The provision. in the United Kingdom, there is a provision of dolls. I don't know dolls, doc. I know that this is a case in which if she tries to leave, we can apply the Mental Health Act in order to protect her from going out because there is high risk on herself. Okay, thank you. Yes, doctor. So what is yours? I want. Yeah.
Panic disorder.
Okay, panic disorder. So just give me 10 minutes. I will pray and I'll come back because.
Okay, sure. So we'll come back after 10 minutes.
Yes. Hello. Assalamu alaikum. Hi, doctors. So, Dr.
Alaikum salam, doctor. Welcome back.
Now, what is your station, doc?
It's a panic disorder. Okay. Um,
Ready?
okay. Yes, ready.
Very clear.
What could be the name of the mother and the patient?
Let's say that I'm you are talking to the father of Mr. Brown. Okay. 1, 2, 3, go.
Father of Mr. Brown.
1, 2, 3, go.
Hello, I am Dr. Bassuni, one of the. Good afternoon. I'm Dr. Bassuni. Are you the father of Mr. Brown?
Yes, yes.
Okay, so I understand that you have some concerns regarding your son, Mr. Brown. I have met with him and we have made an assessment. So can I ask you first, what's your understanding about what's has been going on with Mr. Brown so far?
So, well, I hope as a cardiologist you assess him and to see what is the problem with him.
Well, I understand that I received the referral from the cardiologist, and I understand that the cardiologists have done the assessment and then also did some investigations, which all came to become normal, which is a good thing. So my understanding that he has.
So you are not a cardiologist?
No, I'm the psychiatrist.
Well, I don't want to be rude, but why am I talking to a psychiatrist?
Well, from my understanding that what Mr. Brown has been suffering from is frequent recurrent episodes of chest pain, palpitations, and it has some worries actually that's coming throughout these episodes. So the cardiologist have done the assessment, and then he referred Mr. Brown to me, which where I did my assessment as well.
Do you want to say that he is faking these symptoms?
Well, no, we cannot say that he's faking the symptoms, but from the psychiatric input and perspective, there could be an explanation of what is has been going on with Mr. Brown so far.
Okay, so
Are you
what is
with
wrong?
me?
Yes, what is wrong with him then, doc?
Well, actually, what he's complaining from is something that is one of the anxiety disorders that happens in the form of some feelings which have excessive worries and also some physical symptoms that that resembles the physical symptoms of cardiac issue sometimes. Therefore, he started seeing the cardiologist first, and therefore we should exclude any physical problems first. But what he's explaining so far, that is called a panic disorder, which is part of the anxiety. Have you ever heard about that?
So what is this panic disorder?
Well, the panic disorder is basically an episodes that lasts about 15 minutes. It comes with feelings of worrying, sometimes fears, and as if the person is losing control, and as if something worse might happen. And it comes with physical symptoms as chest pain, palpitations, sweating sometimes, and shakiness over the body. And the
see.
person actually, yes, go
Yeah.
ahead, please.
So, and what could be the cause of this panic disorder?
Well, actually, the cause might be multifactorial. There might be stressors that has been going on recently in his life. There might be also a chemical disturbance that happens sometimes in the chemicals regulating the brain, a chemical that's called serotonin. And also there might be a genetic factor that would happen. Are you aware of any of the family members that having similar episodes?
No.
No. Okay. So I'm here to explain to you my findings and explain to you also the management plan. So, and if you have any concerns, please
Well,
let me
I'm
know.
wondering, is it dangerous?
Well, it's actually it affects, it has a negative impact on his life, his social life, his job, being able to communicate with people and living his daily life. However, there is a treatment for that, and he can get better actually as soon as we start the treatment.
Okay, doctor. So will he get better, doctor?
Yes, the chances actually of getting better are high. Whenever he starts the treatment, it will take some time, but we can actually offer him a package of a management plan and work as a comprehensive team with him. We can offer some talking therapies. We can also offer him some medications, and we will do a management plan in terms of a short-term one and also a long-term one. And hopefully in like 3 to 4 weeks, we're hoping to see improvement with him.
So how can you help him then, doctor?
Well, actually, we will, for his condition, it's important to start a medication for to regulate the chemicals in his brain. These medications works on a chemical in the brain that's called serotonin. And we might also give him another medication that's called benzodiazepine for short term that will also make calm him down and help him in sleep. And we will also refer him to a psychologist that will do a kind of talking therapy that's called CBT, or cognitive behavioral therapy.
Yeah, but he can hardly go out of the house, though.
Well, we can actually ask the psychologist to come and do
One
the
minute
session
remaining.
at home. We can ask the psychologist to go home and do the session at home till he will be able to leave home.
I see.
I hope my information is clear to you so far.
Yeah, very clear.
Okay. Do you have any other questions for me?
No, thank you.
Okay, so I understand so far that I explained to you a lot of information about his diagnosis, that it is a panic disorder, which is a part of anxiety. And we also discussed the management plan, which would be medications and also talking therapy, and also managing the social stressors around him. And I would like also to give you leaflets that would explain more about that.
Okay,
Thank you
very
so
good.
much for coming today.
How do you feel about what you did, Dr. Ahmed? And pay attention to the feedback.
There were a lot of like pauses. I tried to stop to give a chance for the father to talk,
Yeah.
but I tried to avoid talking for 2 minutes or something.
Yeah.
But I think like there were gaps in the in the station, and that's it. That's it.
Okay, so pay attention. I really thank you and don't get frustrated from my feedback. You did a very common
No,
mistake,
please.
which is considered to be a very bad mistake, that you did not introduce yourself properly. You just said, I'm Dr. Bassioni. Who is
Yes.
Dr. Bassioni? You should say, I'm Dr. Bassioni from the mental health services. Father, I thought that you are a cardiologist. So this is the sequence in this station. The role player thinks that he's going to talk with a physician or a cardiologist, but now you are a psychiatrist and you complicated it without saying who are you. So I continue talking with you as if you are a physician or psychiatrist. And then when I ask you, why am I talking to you as a psychiatrist, you did not talk about the mind and body, the simple question, with the typical answer, which we have mentioned. Doctors, the introduction is a simple communication skill which you must master. And I have to be honest with you. In this station, Dr. Ahmed, whatever you are going to do, if you did give a bad impression about yourself in the very first 1 minute, first impressions with this, you are complicating your path in this station, complicating it too much. Okay. You did not identify who are you. I'm Dr. Ahmed. What doctor? Surgeon? What are you? Okay. Why am I talking to a psychiatrist? You did not address this. Multifactorials, and I think it is a jargon. Why did he talk about stressors causing panic attack? First time I know that stressor. I will double check it. Will he get better? This is a question about the prognosis. Doctors, when I ask you, is he going to get better? This is a common question in the management stations. They want to see, are you able to know the prognostic factors of the patient or no? And you did not answer this question. You talked about the management plan and you did not formulate. Please give him a feedback. Our colleague needs your support. Okay. I will give you just, let's go through the PDF rapidly to see how you can tackle this station in a better way. So in this station, you will definitely you will talk with the role player about why he is talking with the psychiatrist. Okay. Mind and body are one unit, etc. Many times the physical symptoms can have psychological reasons, particularly if the investigations and the clinical assessments are okay, like the case of Mr. X. Okay, so this is how we answer this question. What is wrong with him? You are going to explain the panic disorder, and then he's going to ask you, is he faking his symptom? These symptoms tell him that it is genuine symptoms which he's having. Now, what is the cause of this panic disorder? There is no particular cause. Don't say multifactorial. No particular. We don't know particular. But however, we know that about this or this. Pay attention to this, because this is about a real fact about this disorder. Okay. We know that this disorder activates our program, which helps us to face dangerous situations in which there is apprehension, fear, rapid heartbeats, and rapid breathing. Okay, so this is what happens in the panic disorder. The patient is put in a situation for the same medical, same physiological condition as if he is facing a danger. Okay, and there are several factors which increase the chance of having this disorder. As we know, chemical imbalance, family history, anxiety, personality, etc. Pay attention that you must also talk about the medical causes behind this, like heart problems, increased level of thyroid hormones, and low blood sugar levels. Make your answer professional and different from the other candidates to show that you want to say to the examiner that I can be a member like you in the Royal College. So this is how we tackle this question. Okay, is it dangerous? Pay attention. Yes, it is dangerous. It is. If it is not managed, it increases suicidality. The abuse of recreational drugs can cause depression and financial and social problems. The panic disorder is very handicapping and very frustrating to the patients. Is he going to get better? Ideally speaking, you should gather some information about the social and the risk background, or you can go directly and talk about this typical answers. This is a typical answer which you can use in all psychiatric disorders. There are factors which can help in the prediction of the good outcome, like the early start of the treatment, the absence of medical problems or psychological disorders, the absence of stresses and good coping with the stresses, also the family support and the absence of psychiatric history of psychiatric disorder. You can go and answer this question directly with this paragraph, or you can ask him some questions to know the background. It is according to the time management, okay? How can you help him before going through the management plan? Please formulate. I'll not go through the formulation again, just see the video formulation. Now the management, as I always say, make your management discussion very organized so that you are professional. The first point to talk about where the patient is going to be treated and what Dr. Ahmed Suwailam is going to do. You want to talk to Mr. X by yourself, you want to talk with him. Why do we say this? Because there is a point in the mark sheet, as you can see, there is a point in the mark sheet for the candidates who pay attention to the patient's health view. Okay, the PDF is formulated according to this mark sheet. So when you show that you are a doctor who is keen to discuss the medical condition with your patient, definitely you're going to score for yourself at this point. Are you with me, Dr. Ahmed?
Yes, Dr. Hussain.
Okay, very clear. Okay, so I would like to talk with Mr. X to explain the diagnosis, the management plan, and address his concerns. She or he will be treated at home and will be followed regularly by a nurse. Okay, any questions? And talk about the investigations. Already he did some investigations, but he would like to double check them. And then talk about the treatment plan and the medical team, which will cover all his needs psychologically, physically, and socially. Okay. And the backbone of the management is to manage the acute attack and to correct the chemical imbalance, as well as the maladaptive thoughts and behavior behind the disorder. So this is how you talk about the management plan. You want to control the acute attack, you want to correct the chemical imbalance and the maladaptive thoughts and behaviors behind the disorder. Okay, regarding the medication, the chemical imbalance will be corrected by the medications from the group of antidepressants like the SSRIs. If there is no improvements and the attacks are severe and not controlled by relaxation therapy, a short course of benzodiazepine can help to control the panic attacks. Okay. Now the talking therapy. As for the maladaptive thoughts and behaviors, he will find a great help from CBT. Can give a small talk about the CBT, and this is enough. And finally, terminate by sharing leaflets, etc. So this is how you talk about the management, where the patient is going to be treated, what are you going to do, the investigations, okay, and the team, and then the medications, talking therapy, and finally termination. Any questions?
Thank you, Doctor. Thank you.
Very clever, doctor. Don't get frustrated. I'm giving you feedback to help you to improve your performance, okay? Very clever. Who would like to go next? Yes, to Santosh. So I think the only station is left is the, we did not do the elderly mania.
No, that is the only station left. And apart from that, I need to do this morbid jealousy management station also.
Okay, we can do the morbid jealousy. Elderly mania has been done before in the previous Zoom session. I added it by mistake in this session, but we can do a morbid jealousy. If you are going to do it, we can do the morbid jealousy.
Yeah, it's okay. By the way, what is this elderly mania station? Is it that same caused by this levodopa?
The farmer who has been, he took a bank loan and he was traveling by a tractor and you are talking with the son, farmer who developed a mania in the late stage of his life, 65 years old.
All right, okay.
It's a very famous station, okay.
Okay, I'll try to find out more about it. Anyway, so you want me to do morbid jealousy, right?
Yes, morbid jealousy.
Okay.
we are going to repeat it.
Yeah.
Okay, so
Right. Okay. So what is the name of this person, Mr. X?
let's say that you are going to talk to the wife of Mr. Brown, Mrs. Brown. Okay.
Okay.
Ready?
Yeah.
1, 2, 3, go.
Hello, Mrs. Brown. I'm Dr. Kumar, one of the mental health doctors. How are you doing today?
Well, I'm fine. I hope that you understand that there has been a problem with my husband and everything is okay now. Please allow him to go back with me.
Yeah, I'm here to help you in best possible manner. But before that, I need to understand some more things about Mr. Brown so that we can safely send him home. Will that be okay if I understand a few more things
Okay,
from you?
no problem.
Right. So can you please tell me more? How did he land up in the hospital?
Well, he has been, he was out of his mood and a bit agitated. I found him stabbing the pillow. I found that he was in a totally strange condition. So I said to him, we must go to the emergency room to help him.
Mm-hmm. All right. So can you please elaborate more? What was the strange condition?
What?
Can you please tell me more? What was the strange condition that you are talking
He
about?
was agitated and I found him stabbing the pillow.
All right, stabbing the pillow. Okay. And I understand that he has been diagnosed with a kind of mental illness in past, and he was prescribed with a medication called risperidone. Is he taking his medications regularly?
Well, I know that there has been something like this, but I never discussed this with him and I never seen him taking any medications.
All right, okay. And does he use any substances like alcohol to cope with,
No.
or any of the street drugs that he is taking?
No.
Okay, I understand that you are there with Mr. Brown, and apart from you, who else is there at home?
What?
Apart from you, who else is there at home? Are there any
No
children?
one else. There are no one else at home.
All right, okay. And what's your understanding? Are there any safety concerns currently?
Well, just sometimes I feel that he is very angry nowadays. It is not his usual, doctor. That's it.
All right, okay.
Oh, doctor, what is wrong with him, doctor?
Yeah. We have seen and assessed Mr. Brown, and we have seen him assessed him in detail. What I understand that he's having something called morbid jealousy. Have you heard of it?
No, what is this morbid jealousy?
Right. It is a kind of severe mental health disorder in which the person loses touch with reality and has a belief that the partner is cheating on him. And kind of this makes him very agitated. And this is what has been happening to Mr. Brown. Can you relate it to him?
Well, has also, doctor, he's just talking about something which doesn't happen, that he thinks that there is an affair between me and my neighbor, and there is nothing like this.
Yeah, I can understand your pain, and I'm really sorry about that. But since he's having this belief, he's carrying a knife and he's searching for evidences against both of you. Are you aware of that?
Well, he is carrying it out, but he never discussed this with me.
Yeah. And unfortunately, he has said that if he finds an evidence, he might harm both of you.
Well, I don't know, doctor. He just saying words because he's jealous. Please, doctor, let him go back home. I understand that this can be managed at home.
Yeah, I can understand your concerns, but can you please tell me, is there any particular reason because of which you want to take him home?
He is sponsoring all the financial issues. There is rent,
Mm-hmm,
there are bills to be
mm-hmm,
paid. If he stays at home, if he
mm-hmm.
stays in the hospital, everything will be messed up.
Right, okay. So I understand that you are in a difficult situation then. So, just adding to the previous discussion which we were having, he has stopped taking his medications also, it seems, and that's why his illness has returned. And currently, let me tell you that you and your neighbor, both of you, are at serious risk of being harmed by Mr. Brown.
I see, doctor. So what can be the cause of this morbid jealousy?
Right. It's very difficult for me to say the exact cause, but this can be caused by various factors like alteration in some brain chemicals like dopamine. Please don't worry about that. If you want, I'll write it at the end of the interview. It can be caused by not taking medications, like what is happening in case of Mr. Brown. He has stopped taking his medications. It can also be caused by some stressors. It can be caused by some substances like street drugs. Is it okay
I
with you?
see. So
Yeah,
doctor, so how are you going to help him, doctor?
right. So, since he is having this morbid jealousy, which is a dangerous situation, we'll like to admit him in the ward. What are your thoughts about that?
Well, as I said to you, it would be a very difficult situation for me.
Yeah, I can quite understand that, but please don't worry. We will not leave you alone. We'll help you through our social services, which can help you with your finances too.
I see. I see, doctor. So what
Yeah.
are you going to do to help him, doctor?
So, just to recap things, Mr. Brown has presented with morbid jealousy in the background that he has not taken his medications regularly, and he poses
1 minute
significant risk to
remaining.
you and your neighbor, and you have poor social support at this moment. So, we'll like to admit him. In the short term, we'll like to investigate him with some blood tests, heart tracing, and other essential tests. And I'd like to see him personally, do the thorough physical examination, psychological examination. We'll start him with a tablet called antipsychotic medication. Are you with me so far?
Yes, yes, doctor. But he might not accept this and he might want to leave, doctor.
Yeah, in that case, we might have to use the specific section of Mental Health Act to detain him in the ward in interest of your safety and safety of your neighbor. And it's essential for now that you stay separated from him at this moment. And in the longer run, once he gets better, we'll introduce him gradually to the community, and we'll keep an eye on his symptoms, and we'll keep an eye on the fact that he stays safe.
Okay, can I visit him, doctor?
For now, it will not be all right to visit him at this moment, since he is harboring these thoughts against you, and it will be better
Time,
to
time,
see him.
time, time.
Yeah,
How do you feel about
thank
what
you.
you did?
Yeah, I was a bit too fast, and maybe means I was so fast that at times you did not get me, so that
Yeah,
was not
yeah,
fine.
yeah.
Uh, I could have been
No,
a bit
everything
slow
was
or more
good, but
convincing.
just subtle,
Yeah.
just very fine correction of your performance and some information, and you will be more than perfect. Okay, so I hope that some of the candidates give us feedback just to help our colleague. Nobody gave a feedback. So first of all, avoid saying dopamine, just say chemical imbalance. When I ask you, how can you help him, make your signposting for the formulation helps you to show that your answer is relevant to my question. So when I ask you, how are you going to help you? So before going through how we can help you, I just want to highlight the most important points which we are going to focus in our management plan. So I'm addressing her question with this signposting, but when I say I would like to recap what we have just mentioned. When I ask you, how are you going to help him? You say, I would like to recap whatever you are going to say. This means that you are not addressing my concern, but when you say, I would like just to highlight the most important points, which we will focus on in our management plan, this gives the sense that the formulation has a relation with the question which I'm asking you. Is it okay with you? Are you understand?
Yeah.
Okay, so let's see the feedback. Welcome, Dr. Minimize saying, don't worry. Yeah, pay attention to the feedback of our colleagues. Seems that they say you say it too much casually. So let's see the feedback. Now, this station, please understand what this station is about. It is about your ability to set a management plan for the risk factors. Okay, it's not about talking about the psychosis and the investigations and so on. Are you able to set a management plan for a patient who is highly risky or no? Okay. Okay, do you understand the theme of this station?
Yeah.
I hope that everything is clear for you when we talk about the management, about how we approach it. Now, as we say, the sequence of the station depends upon your dialogue with the role player. Either you are going to start by the explanation, or you can take the lead. When you start by the explanation, means that the role player is asking questions, or she might not be asking question, and you can take the lead and ask her some question to have a better background about the patient by gathering the biopsychosocial notes or information. While whether it is this or that, you must be good in controlling your consultation, and you can direct the consultation to wherever you want to do by signposting. Okay, it is a clinical skill. So let's see what will happen in this station. So what is wrong with my husband? Talk about the morbid jealousy. It is a delusion. One of our colleagues saying that, as far as I know, doctors, that delusion is a psychosis because the patient is detached from the reality. He has a particular thought which he is totally convinced with, which is totally irrelevant to the reality. And what I know that this is considered to be a psychosis. One of our colleagues said, no, it is not psychosis. Okay, we can have a discussion about this later on, or have a search. But as far I know, it is a psychosis. Okay, and what could be the cause for this morbid jealousy? Pay attention to this. Give an answer which shows that you are professional. It is very common with alcoholism, cocaine, and amphetamine dependence. Very common. I have a patient who has this morbid jealousy, and he tortured one of his relatives because he has been an amphetamine dependent and has this delusional psychosis against this his family member. So it is common among the alcoholism, the cocaine, the amphetamine dependence, and also some organic brain disorders like Parkinsonism, schizophrenia, and personality disorders. Okay. Of course, the Parkinsonism are not considered as organic, are common data. Okay, with delusion disorder. Sorry, Parkinsonism is not considered to be, schizophrenia is not an organic disorder. Okay, so let's see now. This the answer for the morbid jealousy. Let's see after that. So, is it serious? It is very highly associated with violence. So it is very serious. Actually, the morbid jealousy is very serious, and particularly that the patient has a previous history of violence. Again, doctor, as I always say, in every station there is a challenge for your communication skills. So in this station, the role player will argue that she wants to take him home. Simply say it to him, to her, ask her, so why do you want to take him home, though there is some sort of risk against you and the other person, the third person? She will talk about the financial issues, address this, okay? Is he going to get better? Also, this is a common question, and this is a common answer, which we all know, the factors which will predict the good outcome, okay? How can we help him? you formulate, and when you signpost for the formulation, make sure that your signposting will address the question. Say something in line that I would like to highlight the most important points which we will focus in our management plan. This will make the formulation more close to the question of how we can help him. Saying I would like to recap, well, this can give a sense that you are not answering the question. Okay, the management. First thing, what are you going to do, Dr. Santosh, and where the patient is going to be treated? You are going to meet Mr. X yourself. You are going to explain the management plan and the diagnosis and do risk assessment and address his concerns. Okay, and if he refuses, you are going to implement the Mental Health Act. Okay, the investigations, the routine investigations, but again, among the investigations, you must talk about the alcohol, the substance misuse, and the urine drug screening. Okay, this urine drug screening. Now, the management plan, as I always say, when you talk about the management plan, you are going to talk about it in the last 1.5 minutes. So you must be sure that you are organized in order to make sure that you will make the best use of the 90 seconds. First thing to talk about is the team, which will cover all his needs, physically, psychologically, and socially. Physically, if there is any underlying medical problems from the clinical assessment or investigations, you are going to consult the physician. Psychological, you are going to talk about the antipsychotic, and also you are going to talk about the benzodiazepines. And if the patient is not cooperative, please talk about the depot injection. Okay. Please mention the depot in this case, in the case of a patient who already has a history of non-compliance on the medications. Be professional, show that your answer reflects that you know how to deal with this type of patients who are not cooperative with their medications. Socially, now very important to talk about the social because it includes the management of the risk problem related to this patient. The visits are going to be allowed after the control of the risk. It will be supervised, then there will be supervised leaves, and after that, the patient is going to be discharged under a community treatment order, and he will be followed regularly by a nurse. Okay, very important to talk about this because this includes the management of the risk, which is the main theme of this station. Okay, and regarding the financial issues, talk about the social service and then terminate. Any questions related to this station? Okay, thank you so much, doctors. I hope that you found it helpful. Please you have very limited time. I hope that now you have a regular partner and you are studying regularly. Okay, I hope to see all your names in the pass list. Have a good night. Bye-bye.